Parents are having a harder time getting flu medication for their children. That's according to some general practitioners. They say there's a shortage of these drugs across the board because of global supply chain disruptions and a rise in common flu cases. Lauren Ong with more.
It's been more than a month since the last coronavirus wave, but clinics are still busy. Some general practitioners are seeing about a third more patients with common flu symptoms like fever and sore throat.
After every wave of the epidemic, the preceding couple of weeks or months tend to have lower cases of illnesses across the board, including, once again, flu cases, of course. It's actually more of a relative increase because the last couple of weeks have been quite quiet when it comes to such cases.
Other factors include more overseas travel during the September holidays and the recent relaxation of mask requirements. While clinics can manage the increased caseload, not every patient leaves with the required medication. 5 out of 7 clinics CNA spoke to say they've seen a shortage in paracetamol and flu-related medication, especially those meant for kids.
We see an influx of additional pediatric cases, which makes us run out of pediatric syrups quite fast during the time of the 2 months ago, which is why at some point we even ran out of syrup paracetamol, and we have to write a prescription for parents to actually buy the syrup from the outside pharmacy.
To cope, some GPs have had to turn to multiple suppliers and acquire alternative brands. While doctors say the effectiveness of the drugs is similar, patients could pay more than they normally would. Watson says while some of their medicines have been affected by global supply chain disruptions, key products for children are still available at their stores. Still, some doctors warn of self-medicating, especially as the annual influenza season approaches.
We strongly advise against patients taking a lot of medications for preparation. We do see that there is a culture in Singapore where parents will be siding on the side of caution, and they will come in for medications even when there are no symptoms. These medications can have side effects, which can actually affect performance, in particular students taking the PSLE exam.
Instead, they say flu shots are a better way to keep safe.